nitrogen mustard gas, immunotherapy, vaccines, immunotherapy. A lot of indirect side effects from taking these drugs. There will not be a cure for cancer. Welcome to the Crossover Connections with Jack Wang podcast. My name is Jack. I'm a scientist and college professor at an Australian university. How has treatment of cancer improved then versus now? Of course, back in the day, cancer treatment was not a thing. People thought there's no cure, there's no treatment. Let's just find out if it was cancer after the person died. Really shocked me when I went back and read it. I didn't really know. Nitrogen mustard gas, believe it or not, it was used for treating cancers because at the heart of it, these nitrogen mustard gases, they are designed to be cytotoxic. They kill cells by preventing DNA replication. The cells that are growing the quickest in cancer patients will be cancer cells. It doesn't mean the nitrogen mustard gas won't kill all of the other cells, but they will kill the cells that are more quickly growing the quickest. And it might shrink that tumor, so people were very excited. There have been a lot of efforts in trying to streamline the structures of these nitrogen mustard compounds to see if they can take away the bits that are really bad for you. It is still a little too dangerous, a little too many side effects when not administering nitrogen mustard gas as part of a very routine visit to your oncologist in this day and age. We've come a long way. On that issue of specificity, the next category of drugs had a similar problem, immunotherapies, and it is a derivative of folic acid and it is an anti-neoplastic drug used in chemotherapy. This drug works by binding to the folate binding site of the enzyme dihydrofolate reductase. Dihydrofolate reductase makes a lot of nucleic acids for our body. It makes the components, the building blocks of DNA. It also makes the building blocks of energy that cells use. So if you're blocking this enzyme, then you will not be able to make the raw components of DNA. This drug, immunotherapies, would be able to slow down cell growth because it literally stops the DNA from having enough components to be used in cell division. Sounds great, but again, this has an issue of specificity. The cells in our body that will grow the quickest, yes, would be cancer cells, but also it would be skin cells and epithelial cells. Epithelial cells are in the lining of our mouth, in our respiratory tract, in our stomach lining, in our intestines. So it's no wonder that people who go on chemotherapy, also radiotherapy, their hair falls out, they're always having nausea, they're vomiting a lot, they're going to the toilet a lot, they just feel terrible all the time. It's because these drugs are targeting cells that are quickly growing, which include cancer cells, yes, but also include all of the other cells in your body that are doing their normal functionality. Immunotherapies, yes, it's better than mustard gas, but still it's processes that it's targeting is not that specific to cancer cells alone, and you have a lot of indirect side effects from taking these drugs. Even if they're not cancer cells, other cells are growing and they will be attacked by these drugs. That's much more primitive in terms of how we think about cancer therapies. How has cancer therapies evolved? Vaccines, and the most famous cancer vaccine is the one against HPV, human papillomavirus, which is the most common sexually transmitted infection in the United States for sure, but I think in the world in large, it is a cancer caused by a virus and is spread from person to person via sexual transmission. And once you're exposed to the virus, your risk of cervical, vaginal, vulvar cancers and all of these cancers relating to those areas in both men and women, they go up dramatically. So really the vaccine limits the effect that exposure to the virus will have on the person and therefore cuts down on the incidence of these cancers. The vaccine against HPV is Gardasil. Once you identify the original cause, then treatment becomes a more streamlined process, and this provides a model for us to examine all the other cancers. But the problem with all the other cancers, let's say skin cancer, is that exposure and the cause is multifactorial. You really can't eliminate that risk factor completely. Vaccines against other kinds of cancers will have to have a slightly different strategy. Again, illuminating the idea that we actually have a really good cure for HPV and cervical cancer. It's this vaccine. It's great. It works incredibly effectively. It's just because cancer is over 40 different diseases, this one treatment, one type of cure won't work against all of these other cancers out there. The other type of treatment that is increasingly gaining momentum in anti-cancer therapies, immunotherapy. The one that is most recently on everyone's radar is something that's called CAR T cell therapy. CAR T cell therapy. And the CAR in CAR T therapy stands for chimeric antigen receptor, CAR T cell therapy. It retrains T cells to recognize cancer cell surface antigens so that it only targets and kills cancer cells. CAR T therapy modifies these T cells and retrains them to only recognize and kill cancer cells. That resolves the specificity problem that drugs like immunotherapies or nitrogen mustard gas, they can't quite overcome that specificity problem. They're just killing all cells, and the likelihood that they're going to kill cancer cells is higher than killing the other cells because the cancer cells grow the quickest. But these kinds of immunotherapies, they really work much more effectively because they're training immune cells to recognize one specific type of cancer cell structure. And this, I believe, will be the future and limit the other side effects you may experience through cancer therapies. I'm Jack. Hope to connect with you again next time around.